Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We are a health system with 3 academic medical centers. Our AMC status means we have our finger on the pulse of the latest treatments and technologies in medicine, and we're bringing it right to our community. Over the last year on this podcast, we have delved into our health system service lines and the innovative work our doctors and professionals are doing to improve treatment and the patient experience. Highlighted our academic partnerships and programs and how we are cultivating the next generation of healthcare professionals. We've explored trending topics in the world of healthcare today and what they might mean for the future of healthcare. We are your hosts, Dr. Toni Flowers, Corporate Chief Opportunity and Social Responsibility Officer,
and Kristen Gradney, Chief Wellness Officer.
As we approach the end of 2025 and the beginning of a new year, we want to look back at some of our biggest accomplishments and impacts this year.
Well, Dr. Flowers, let's dive right in and talk about some of the exciting innovations and some of those great accomplishments that we've had this year.
We've made significant advancements in cardiology. Most notable, East Jefferson General Hospital became accredited to perform LVAD procedures and heart transplants. In a region with some of the worst rates of heart disease, this is vital for our population. Soon we'll be able to perform lung transplants too. Turo earned the Joint Commission's Gold Seal of Approval and the American Heart Association's Heart Check Mark for Primary Heart Attack Center certification. East Jefferson is also helping men's health outcomes with the establishment of a new Transformational Prostate Cancer Research Center, led by internationally known expert Dr. Oliver Salter. Maternal health. Turo continues to lead the way in maternal health, affectionately known as the place where babies come from. With their advanced certification in perinatal care and verified level 4 maternal care by the Joint Commission, as well as their quality improvement initiative, they are equipped for every birth, even high-risk pregnancies. However, they are not the only ones. All 5 of our birthing hospitals were recognized for their excellence by the state, meaning women can choose the most convenient place for them without having to worry about quality of care. Birth Ready Plus, East Jefferson General Hospital, Lakeview, Turo, and West Jefferson Medical Center, and Birth Ready Lakeside. Kristen, there's so many other things that we've done. You want to talk about some of those?
Sure. So many other areas that are important to us. Louisiana, as we know, has some of the highest rates of cancer. So LCMC Health hospitals are absolutely proud to be leading the way in groundbreaking research and treatment of breast cancer, lung cancer, and so many more cancers. And we're doing earlier screenings and less invasive procedures that lead to much better outcomes. And we have our Rare Cancer Center, which is one of the few of its kind in the nation and attracts people from all over the country with complex cases that can be treated right here in our city. And then at pediatrics, we have Manning Family Children's, which was such an exciting development. So 2025 marked a bold new chapter for kids, as we proudly announced the renaming of our pediatric hospital to Manning Family Children's. Our partnership with Manning Family will help us serve even more kids and move faster toward our vision of making Louisiana the national leader in child health and well-being. And we also made medical history right here as well. Our first patient began the process of gene therapy to cure sickle cell disease. What an amazing achievement.
That was awesome.
We also opened our first Thrive Kids Community Clinic in New Orleans East, which expands the access to primary care and mental health services for our children in our community. In addition to that, our community hospitals have been providing comprehensive care. So our only hospital on the North Shore, Lakeview, continues to be a beacon for our community. They were recertified as a Level 2 trauma center, the only one in St. Tammany Parish, and they provide a vital lifeline emergencies in that area. And as a rural hospital, there's often a misconception that they can't handle everything, but that's not true. They've recently expanded both their cardiology and women's health services, and also behavioral health care. And we know New Orleans East has a deep root in its community and has continued to fill a much-needed gap for care in that area. So now they're offering primary care, stroke care and prevention, diabetes care, and more at their state-of-the-art facility while addressing health disparities and serving that population in a way that is meaningful to them.
Yes.
West Jefferson Medical Center serves our community on the other side of the Mississippi River with a premier emergency department and renowned neurological care.
Yeah. Lots of accomplishments, yes. So LCMC Health serves as a regional resource. When we look at University Medical Center, it is our area's only level 1 trauma center and verified burn center. University Medical Center has positioned itself as a regional gem. Their burn center was also named Burn Center of the Year by the American Burn Association, the youngest center to ever receive this recognition. The center is really doing innovative work with spray-on skin. Can you imagine? Wow. Helping patients recover quicker and with better results. Their 10th anniversary was celebrated this past August, the same month as the 20th anniversary of Hurricane Katrina, which gave us a chance to reflect on how the healthcare landscape has transformed. Kristen, with all the innovation and work that's gone on this year, has LCMC Health or any of its hospitals gained any recognition?
Absolutely, in so many different areas. You know, we mentioned heart disease disproportionately affects Louisiana. And so it was so important that the American Heart Association's Get With the Guidelines program recognized 6 of our hospitals for its continued success in the treatment of stroke, heart failure, and the implementation of resuscitation. So important to not only our facilities, but our communities. The majority of our hospitals received above average from Leapfrog hospital safety grades, which really speaks to our steadfast commitment to improving patient outcomes. And as we mentioned, all of our birthing hospitals were recognized by the State Health Department for their excellence in maternal care. This is especially crucial in our state with consistently the worst maternal and infant outcome.
Yeah.
Truro and East Jefferson were also named to Newsweek's America's Best Maternity Hospitals. So that's a gem. We have those right here in our system. And meanwhile, Newsweek also named Manning Family Children's among America's best children's hospitals. Several of our leaders, physicians, and nurses, and more were recognized for their expertise and compassion, not only locally, but nationally. For instance, 20 of our dedicated employees were named healthcare heroes by a local publication. And LCMC Health as a system was also recognized for workplace excellence by Veckers, Newsweek, and Forbes. So we just...
There ought to be proud.
Absolutely, absolutely. So LCMC Health has always prided itself as showing up for the community. Dr. Flowers, tell us a little bit about the community impact that we've had this year.
We have certainly been present in our community. We sponsored and supported several community events throughout the year, from being the title sponsor of the Crescent City Classic Race Series, promoting an active lifestyle, to promoting first aid stations in our mobile nursing nest, to events like the Fritch Quarter Fest. Everyone knows Mardi Gras in New Orleans is the biggest free party in the world, but everyone might not realize the work that happens behind the scenes to keep everyone safe. Our staff works closely with the local health department and the EMS along the parade route, volunteering their time to keep parade goers safe and healthy. More recently, we partnered with Second Harvest Food Bank to help boost food donations and funding during this busy holiday season. Did you know 1 in 6 households in Louisiana is at risk for hunger? And we're proud to rise to the occasion and combat this challenge. Not to mention all our free health fairs and screening events that we provide to our community throughout the year, making healthcare as accessible as possible for our community. We're launching our Healthy Self or Heal Thyself faith-based program that we are partnering with many local church pastors and their health ministries.
What a gift. It's great that our community gets to experience healthcare not only in the 4 walls of our hospitals, but actually where they are.
Absolutely. Kristen, in healthcare, we are constantly training and preparing ourselves for all kinds of scenarios. Can you walk us through some of the incidents where our staff showed up admirably?
Yeah, thinking back over the past year, we have endured so much as a system and as a community. You know, and unfortunately, we think back to January 1st and the beginning of the year, we had a tragic start of the year with the Bourbon Street terrorist attack. As our area's only level 1 trauma center, also located right down the street from the incident, University Medical Center stepped in. The staff showed up and received the majority of the survivors, about 30 patients altogether. Our staff did everything that they were trained to do. They showed up in that moment. Our trauma psychologists were there for those who were affected. our team set up a family reunification center. And that day, we experienced something that we would never want to experience again. But our peer support specialists, our trauma psychologists, our nurses, everyone stepped in and provided the best care to those families and the patients. We are incredibly honored to have been able to do that for our community. UMC also launched the NOLA Strong Fund and worked with students from the New Orleans Center for Creative Arts and local artist Terrence Osborne to create Mardi Gras ladders for a raffle to support the survivors' attack. Shortly after, Louisiana was hit by a historic snowstorm, right? So our roads were shut down. And in Louisiana here, snow is a beautiful thing, but we don't always know how to handle it.
Exactly.
So while effectively the whole city was shut down, LCMC Health EMS was answering calls to serve and even helped deliver a baby. Throughout the year, we also worked with the city's health department and Office of Violence Prevention to develop the violence prevention ecosystem. We recognize that violence truly is a public health crisis, and we are working to provide our community with the much-needed resources, not only to intervene, but to prevent violence where we can. Additionally, we saw Louisiana become a hotbed for diseases like measles, pertussis, RSV, even a dangerous bacteria. And we were able to position our experts to spread vital information to the public and respond in the moment. So, Dr. Flowers, we have talked about a lot. We've talked about how our system showed up the past year, how we continue to show up for the community, but we always ask our guests at the end of every podcast, what do they do to keep themselves well? What advice do you want to give our listeners about staying grounded and going into the new year?
This is so important because there's so many emotions that are active during the holiday season. There's joy and there's sadness. And it's important that we are able to identify what we're feeling, that we have community so that we can share those things because our mental health impacts our physical health.
Absolutely. And I would say as we think about the past year, as we do for a system, we should do that for ourselves and really reflect on where we've been. And that really helps us figure out where we're going. Where do we succeed? Where were our opportunities? Where do we want to take a breath maybe this year and really plan how do we do that in the best way for ourselves so that we can continue to show up? Because you cannot give what you do not have.
That's right.
So it's important for us to stay well individually so that we can continue to show up the way that we do for each other.
So, Kristen, what do you do to stay healthy?
I really take some time out around this time to really reflect on my why, and reconnect to what it is. And most times it stays the same. My why is my family and my children. But then what is my new why? Have I rediscovered a passion? Something I've decided that I want to start a new crafting hobby. So I'm going to center myself in that and really focus on being well, not only mentally, but physically, emotionally, so that I can continue to help others be well.
So important. Well, I have decided that this is the year where, being a nurse, always caring for others, but I have talked and preached so many times that if you don't take care of yourself, how are you going to be in a position to take care of others? So I am practicing what I preach. So I'm putting myself at the top of my to-do list as we move into 2026.
Absolutely. Thank you for your time with us today and for being my co-host this year. And we look forward to another year.
Absolutely. It's been great. And I'm glad that we finally have a chance to come together.
Absolutely.
Yeah, it's been great.